let's start.
Sorry.
You know, if we're just thinking about our setup, okay? So, table as low as it can go. That allows for a little bit more of a drop in the use of gravity to assist. I'm going to have Mariah lie on her side. And again, the more consistent you can be in your setup, the more consistent you can identify the things that go well and the things that don't go well. So I often will have folks be a 2 fist away from the edge. Now Mariah is rather mobile in her spine. And so as such, we may need to add on secondary and tertiary levers. You know that she's pretty mobile because like as soon as I like bring her down, right, she already rotates. So go ahead and flex back up if you don't mind with the legs. Good. So we have our distance there. So, you know, they teach you in school, they're like, you like close your eyes and you're like, is it gapping? Is it not? Right, so you just want to like flex down so you get a little bit of motion. Don't over exaggerate it. Good, and then I like to get this up the knee that is such that there's a little bit of tension in the system. We've dialogued about previously about this foot needing to be free. So you can see that she's already rotating to me, so I'm just going to cue Mariah. This isn't usually part of the setup, to scooch her hips such that she's not going to rotate too far. Okay, and with someone being quite mobile, I do want to create a gapping technique. And so you don't want to overcook it with rotation because that's going to be your thrusting direction or your vector. So I am going to add a little bit of flexion here. So I ask her to wrap her hand around as I no. So she wanted to rotate, but it's really more just this flexion. And then I'm going to bring this hand behind head. And so I call it like the kind of the supermodel pose, right? She's kind of
good.
Yep. And then there's, to kind of check yourself, one thing that you can do is like the tipping point. So if I rock her, she should fall back into that same position. If she's unbalanced, meaning like I go like this and she just rolls forward, or if I go like that and she rolls too far backwards, she's not quite balanced. So looking at her right now, I want a little bit less rotation, a little bit more flexion. Okay, the hand, I'm going to get up on the mammillary process with my pisiform. So I'm going to come up and like I usually like to go onto skin. Sorry, Mariah, I'm going to drill this down just a little bit. All right, so then I'm on PSIS, and that contact is going to be for my target segment. So this hand is my long lever, or it's just a stabilizing. Sorry. Yep. Sorry for that. Yep. So you don't want to be on shoulder. You don't want to be on boob, right? You want to be kind of right under the chest wall. And then my long lever is my ASIS and my femur on hers. So I rotate her in, and then as soon as her pelvis hits 45 degrees, I drop. And you want to drop with a little bit more conviction than you may otherwise expect. So I big breath in, big breath out. I rotate towards, come in, and then drop like that. Mm-hmm. Okay, you can do the breath in, breath out. Sometimes, you know, there's people have different preferences. One, like the patient like can guard a little bit, or because they expect it coming. The other thing that I often preface with this is that, hey, you're going to feel the edge, but don't worry, I got you. You're not going to actually fall. The other things that can be uncomfortable for the patient. Are you okay to go back into it for a moment? Yep. So we get her back into it.
See if I can remember.
Yeah. So that's right. Yeah. So always help them or put them. Don't let them put themselves into it. Right. So here. So if you come around the side, what you'll see is that if I don't get her close enough to the edge, then when I go to thrust, all I do is I just jam her knee into the table and she's like, ow. The other one is where they're lying too close to the edge with their torso and their scapula is lying on the edge. And then when you go to block, it also is painful and uncomfortable for them. So that is the what they call the mamillary technique. gapping rotation. You can get up as high as your TL junction. And again, your long lever, I mean, this is a very long lever, and I'm going ASIS to ASIS, and I'm dropping down with my weight like that. It's not really the pull. If we go, yeah, so we'll pause there, but that's good.